If you are good, I can start.
So now, Didi, you can start. Like we are live on YouTube.
So, I welcome everyone, all the panelists who have gathered here for this panel discussion on need for holistic human health. And before I start, I'll introduce myself. I am Dr. Mrinalini.
अब रह गया
I have
सर रूम नंबर 4 आपके वाला.
So, I am Dr. Mrinalini and I have done MBBS and MD in anesthesiology, and I've also completed a pain management physician, and I'm working as an associate professor in anesthesiology in SRM Medical College Hospital in Katangalattur, Chennai. So that is about me, and I will be moderating this session. And thank you so much for all the panelists who have joined here. So now let me go on to introduce all the panelists formally for all the delegates and the YouTube viewers who have joined here. So first we have Dr. Eloji Rao with us. Sir has done PhD from Indian Institute of Sciences, Bangalore, and he has did his postdoctoral research associate at Columbia University, New York. Sir is also serving in Board of Directors, National Consortium of Ayurveda Medicine in USA, and he is a member of national team Hindu Swayam Sevak Sangh in USA, and he is currently the international convener of Global Indian Scientists and Technocrats Forum. Happy to have you with us, sir. Namaste, sir.
Thank you.
And sir, if you can just say hi so audience will be able to see, because all the panelists are displayed here.
Namaste to everyone. It is a pleasure to join all of you and look forward to actively participating in the panel discussion. Thank you.
Thank you, sir. And we have Dr. Vidya with us. She has done her MD and DNP in anatomy in JIPMER, and she's currently working as an assistant professor in JIPMER. She's also the secretary of Sri Paspu Group of Educational Institutions in Tamil Nadu, and she's a member of National Academy of Medical Sciences, India. Welcome, Dr. Vidya.
Hello everyone. Can you hear me?
Yeah, you're
Yeah.
audible.
I'm very glad to be one of the panel members here. It's my pleasure to be here and waiting eagerly to discuss more about the human values in health. Thank you all.
Welcome, Dr. Vidya. And we have Sri Swapan Chanana with us. Sir is from PCT Group of Institutions in Ludhiana, and Sir has been teaching in the Department of Business Management for the last 25 years. And additionally, he is also handling the responsibility of director. And he has been teaching the subject of universal human values regularly to various courses in his institution. Welcome, sir. Glad you could join us today.
Namaste to all, and really looking forward for a meaningful discussion today. Thank you.
Thank you, sir. And we have Dr. Sasikumar Gurunathan with us. Sir is an integrative medicine specialist and general practitioner in Australia. Sir has done his MBBS in India and diploma on mental health in Northern Ireland, UK. And he has undergone psychiatry training in Westmead and Cumberland Hospital, Sydney, Australia. He has also served as captain in Indian Army, and he's currently practicing as a holistic healthcare professional at Access Health, Tankari, Australia. Welcome, sir.
Hello, good morning to everyone. It's a pleasure to be with you all. Thank you so much.
Good morning, sir. It's morning there.
It's a good morning, but for you it's very early, so I appreciate all
yeah. It's
great.
night for us.
Yeah.
Welcome, sir. And we have Dr. Monica Sharma with us. Ma'am has done MSc and PhD in mathematics and MSc in value education and spirituality. Ma'am is currently working as an assistant professor in Delhi Technical University. Welcome, ma'am. I think there's some network issue with ma'am. And I'll introduce Dr. Umang Munjal. Ma'am has done her bachelor and master's in veterinary sciences and PhD from Friedrich Schiller's University in Germany. She has an extensive background in nutritional toxicology and molecular genetics, and she's currently working in diagnostics in Mannheim, Germany. Welcome, ma'am. Ma'am, am I audible?
Yes, you're audible.
Okay. So now, before we dive into the discussion, I'd like to share the format of the panel. So the entire session will last for 90 minutes, and it will begin with a brief 10 minutes recap from the key topics that were covered in the earlier hours of the conference, and a little brief about the UHV point of view on need for holistic human health. And the discussion session as such with the panelist is scheduled into 2 or 3 rounds, and each panelist will be allocated 3 minutes per response to the questions asked by the moderator. And you will notice a clock at the right top corner of your screen, and you will hear a bell sound if time exceeds. So I kindly ask everyone to keep the responses focused and concise to help us cover as much ground as possible. And after the 45 minutes discussion is over, we'll have a 10 minutes question answer session where we welcome questions from our delegates. And finally, I'll formally close this forum for the day by presenting a brief summary of the essence from our discussion. So I request all the panelists to keep your videos on for the entire session. So with that, let me provide a quick recap of the proposals and key points which were shared during the morning sessions. So for that, I'll just start my screen sharing. So I hope the screen is visible to all.
Yes, you can put it in full screen. Okay.
Yeah.
Yes, perfect.
Yeah. Today, our topic will be on need for holistic human health, as we all know. So before we go into why we need for this holistic human health, we'll just brush our idea about what is health. And then we'll consider this question whether we are addressing it adequately. So we can see many definitions of health, like WHO has defined health as a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. And this textbook, Shushruta Samhita, published in 2005, is defining health as a state of complete physical, mental, and spiritual well being, that is, a total psychosomatic equilibrium. So, with these definitions in mind, we can ask ourselves whether our healthcare system today is addressing health adequately in all the dimensions. So, when we look at the state of physical health today, there are undoubtedly many achievements, like communicable diseases have been brought into control through antibiotics, vaccinations, and there has been excellent advances in trauma care. But in spite of this, there are still many concerns, especially when it comes to non-communicable diseases. Like there are so many statistics saying like 74% of all the global deaths are due to non-communicable diseases, and each year more than 15 million people die from non-communicable diseases, and in India alone approximately 5.8 million people die from non-communicable disease every year. And these non-communicable diseases are called the 4 big killers according to WHO. And again, when we consider the state of mental health, statistics from WHO says that in 2019, an estimated 280 million people were suffering from depression. And suicide was the fourth leading cause of death among 15 to 29 years old. And we can see the statistics from National Agricultural Safety Database, which says 75 to 90% of illness and disease is stress related. So again, there's this question we can ask, are we treating mental health adequately? And is this perhaps something we are missing here? So do we really understand the root cause of these and root cause of stress? So when it comes to stress, statistics again says that it is a common risk factor for 75% of most of the diseases like hypertension, atherosclerosis, non-alcoholic fatty liver, depression, Alzheimer's and pancreatic diseases, and even cancer. So when we see overall the state of health, there's an alarming rise in non-communicable diseases, and even at younger age, the stress and mental health issues are at an all-time high, and we have the impact of mental health on the physical health, leading to many diseases like diabetes, hypertension, and obesity. And we can also see some concerns regarding our health education and healthcare system. So is our focus on being healthy, or is it on getting rid of diseases? And even when treating the diseases, are we really curing the disease, or are we only managing the diseases with lifelong medications? And when it comes to mental health, are we addressing the mental health adequately, or are we largely managing to medications? Are we addressing the mind and the body, or are we focusing only on the body? So some other fundamental issues of concern in our healthcare system today is concerns regarding the values and ethics. There's a larger concern that the focus is largely on profit maximization, and there is a lack of values in healthcare profession and in healthcare system. And are we as human beings isolated entities, or are we part of a larger whole, that is a part of family, society, and environment? So do we have any interconnectedness with nature, and is this lack of concern for nature also adding to the disease burden? Like for example, we can say genetically modified organisms and pesticides in food is linked with cancer. And there is also concerns regarding the overly expensive healthcare system today and the sustainability of the healthcare system. So again, there's this question: despite all the time, resources, and billions of dollars and efforts spent on health, why is all this happening? So is there something we are missing here? And what are we teaching our students in medical education stream? Is there a need to question our medical education system itself? And more fundamentally, is it time to question the very perspective of health we are giving in education? So when we can see there's one approach which is disease centric, and there's another approach that is health centric. So we can see where our focus is when it comes to our healthcare system today. Is our focus disease centric, where we treat diseases like diabetes, hypertension, and arthritis on the symptom based, like giving medicines to reduce the blood sugar, giving medicines to reduce the blood pressure, medicines to reduce the pain, and so on? Or are we really understanding the root causes of all these and addressing the diseases at their root cause? So this will be the UHP point of view for our discussion today. So with this, we'll move on to the panel discussion. So I hope you're all a little set with the background stage for our discussion today. So today we'll be discussing some of the concerns which we have just seen now. And I would like to hear your ideas and viewpoints from your own experiences and your practices regarding this. So if we look at the definition of health, that is a complete physical, mental, and social well-being, do you think we are addressing health adequately today? So Dr. Vidya, what is your
Yes.
opinion on it?
Yes. Am I audible? Yeah. Am I
Yeah,
audible?
you're audible.
Yeah.
You're
So,
audible.
yes. First of all, at this point, this is a nice question. We have to be addressed because, as you said, our focus is mainly on the health, which is physical health. We are not maintaining our mental health properly, particularly in this era. So I have been associated with the students for a long time. The main thing I'm seeing is nowadays students, they are totally out of the way, not only in treating diseases or the other things, basic things, even the respect they are giving to the teachers. We have to teach them to wish the teacher when they are seeing outside. So the entire thing has been collapsed. So for that, we have given the foundation course nowadays. So in the foundation course, we are starting from the basics. We are teaching them to wish. That is the first thing we are supposed to do. Then we have to teach them the human values. They are not getting their human values correctly. Nowadays, it is full of social media and corporate thing has been totally changed the era. So what medical students thinking like whatever is shown in social media is more than what we teach. So they are thinking that they have all the resources and they are mastering in everything. They are not under proper role. Like that is my opinion. And this particularly health related thing, what you are asked is, we are more, according to me, we are more focused on physical health, and that too symptomatic treatment we are giving. So whichever case we are seeing, first is symptomatic treatment. So once the patient has been symptomatically improved, what we think is something has been solved at that point. So we are having many things to go upon, and we are also having some personal things, and we are also running behind some personal things. We are not sitting and thinking much about the other person. So we have to, I strongly agree that we have to address all mental health also. So this is my perception. I don't know about others, but in medical educations, we are taking necessary steps, I believe, because NMC also has now started this foundation course. The main theme of foundation course itself is giving basics about the human values. First, they have to know about the human values. Say, for example, if you want to give one small example from my department, as I am an anatomist, we are having cadavers. First of all, students are not knowing the value of the cadavers. So they should know the value of the cadavers. So we have introduced something called as ATCOM, so attitude and communications in the foundation course itself. So we are teaching the source from where we are getting the cadaver. So with that only, if we teach that only, students will realize the necessity of the cadaver. They are thinking that they are getting all the sources from the YouTube and all the social medias. But without a cadaver, definitely we cannot touch the human body. So main thing is they should realize that these cadavers are not easy to get. So because they are very poor people, they are not having money to take their body to their own place for the funeral. So for that purpose, they are donating the body at the hospital itself and leaving. If we tell this student only, they will know the value of the cadaver and their real what they will give the respect what the cadaver deserves. So in addition to the normal things what we are following so far, we have to introduce many things, and we are doing that, but it is not there is a gap between what is given on the paper and what is actually practiced in the foundation courses and all. So this gap has to be filled up. And another thing, this corporate hospitals.
Dr. Vidya, your
Yes.
time is up. We'll come back to
Okay.
you in another round. We'll have
Okay.
round and more panelists to cover. So
Okay.
sorry for that.
Yeah,
But
no
it was
problem.
nice. The way you start teaching your students with values, it's a very nice point to be followed by many. It's very
Okay.
nice to hear your viewpoint. So I would like to ask the same question to Dr. Sasi Kumar. So if we look at the definition of health today, do you think we are addressing it adequately in all the aspects, physical, mental, and social well-being? Dr. Sasi Kumar?
Yes, thank you. I'll draw my experience to address this question. The thing is, initially I worked as a psychiatrist for 10 years. And then I found that what has happened there is we were addressing the mental health issues, but by addressing the mental issues, what we say is we're not really addressing the mental issues. We just address the symptoms. The symptoms is just symptomology. Like if you see a tree, it is the root problem is different, but the leaves and flowers might have problems. So we address the leaves and flowers by giving some pesticides and things, and that's what we are doing in medicine. And so this really put me off. So I moved from psychiatry to general practitioner thing. The reason is because I didn't have much freedom to practice social health and spiritual health and the real aspects of mental health. So your question about whether we really practice mental holistic health in medicine is not at all at this stage. But the awareness is growing and it has to be taken at the individual level as well. So the decision for me to move from psychiatry to general practitioner 12, 13 years ago was a big thing. But I did it and I am very comfortable now. Very comfortable in doing that, implementing the holistic care to my patients, because I found that big lacunae in the system, and that lacunae is felt by the patients. Not only by the patients, but also the professional thing, I didn't have satisfaction. So that hat has been covered up by giving a holistic care. By giving holistic care is incorporating the mind health, spiritual health, and the and mainly the social aspects as well, which we normally don't address in medicine. Yes, so we normally don't do that, which needs to be addressed as well. I think that's the point of this whole seminar today, yeah, or conference. Yeah. Yes,
Thank you, Dr. Kumar. That was a very insightful thing. And the decision you made to move from your core discipline to a general practitioner incorporating all the three dimensions is truly inspiring and something we all need to look into. Maybe we'll get ideas from you at a later date. Thank you for sharing that. And now you rightly pointed that medical education today is not addressing this. So I'd like to place this question to Dr. Eloji Rao. So, with your background, sir, you are an international convener and you have contacts with many people and you are in a position like a policy holder. So, do you think the focus of our medical education seems to be more on disease and its treatment rather than on the health? So, if so, should the health education we give to our medical students also focus on how to stay healthy in addition to its disease and the treatment? Dr. Eloji
Thank
Rao?
you, Yes, thank you, Murali. So it's a very interesting question, and I heard the experiences and observations as well as the practices and the intricacies from the previous two panelists. As you recognize, I'm not a medical doctor, but some of the things what I see today that are ongoing is really, really puzzling. Let me share two slides to bring something to your attention. Let's see. Here you go. This is the one. So, if you know, the United Nations in the past has declared as International Year of Food of something or the other. It may be millets and the vegetables, pulses, and family. The whole idea here was two things. One is, can you fill the bellies in the world? Second one is, can these food items be not the cause for any kind of causes of diseases? However, what is even more puzzling is, see the information today the world is dealing with. The whole world's economy is about $110 trillion. Look at these indirect costs or the hidden costs. Today, the moment I am diagnosed, I'll be paying for the doctor, lab tests, medication, and things like that. This is what about 11% of the global economy is being spent towards this $12.7 trillion. Why? Is a question that we need on this. As for the type of food that we are using, type of food that we are preparing, type the way the food is consumed, all not traditional mix. Why are you having so much diabetes in India? Why the cancer? Why the heart related? They're all because are not balanced or for healthy living. That is not my, that is in a way, we don't know. I never learned about good nutrition in my childhood. Probably you also did not learn about good nutrition in your professional education. If we don't know the impact of food we eat, how can we even consider thinking about treating? If you know the impact of the food, probably we will eat food in a form in such a way that no medicine we need. If you look into the traditional texts of Bharat, Ayurveda, in Charaka Samhita, he mentions very simplistically, if you know how to eat the food, then no medicine is required for you. And if you don't know, how, how to eat the food, then no medicine can help you. So today our decisions are based upon what is that we can afford and whether it is tasty, and we just fill the belly. We don't even understand the way the food is being processed. And consequently, we are we are complicated much through because the way the food is being grown. All the food today is chemically grown with fertilizers, herbicides, pesticide, fungicide, and all those chemicals are coming into our body, unknowingly consumed chemicals. Added to that, today the shelves in the stores are flooded with food items which are processed, high fat, high sodium, high salt, high sugar, and whatnot. And when you eat these kind of foods, now you are adding, knowingly eating the chemicals. Parents don't know. These are the things I think we should understand in terms of incorporating in our education system. If we
Thank you, Dr.
incorporate in our
Ilora.
education system, the health, in other words, our values can also be appropriately
Yes, Dr.
attended so that we all can live happily. Thank you.
Your points are very well taken. You started very well off with global crisis and brought it down to individual level. And you also told us how all these things are not like taught in our education system today. And you also touched into another very important topic on our discussion today, how the impact of nature and interconnectedness of human being with nature, or how all the food which are getting polluted by the soil and getting from nature is affecting human beings. So these points are very well taken. So there is a need for all these things in education, right? Like you rightly pointed. Thank you, sir. Thank you so much for that. So now let me move on to Dr. Monica Sharma. Ma'am, today we discuss something about mental health. So mental health issues, as the statistics say, are on an all-time high globally. And like statistics are saying, there are 74 to 88% of Indians suffering from depression and anxiety disorders. So, do you think our approach to mental health should we maybe relook our approach on mental health?
Yeah, so I want to say that total holistic health is not taken care of. So that's why we can see that large number of hospital, multi-specialty hospital is around us, but the number of patient is also crowded. There you can see that I am putting up in Delhi, so I can see that a few time back only AIMS and Safdarjung hospital is there, but now there are so many hospital and there are so many technical facilities are available, like MR, CT scan and all that, no, like echo and everything. But this shows that somewhere we are lacking some aspect of health issues. So if I remember that in my childhood, I never heard the word stress and anxiety, and there is no such facilities available right now as we have now. But when we speak our children, they say that they are so much in anxiety and so much in depression, and they are committing suicide. So it's rightly you have said that some mental aspect is missing to be addressed. So I feel one more aspect is emotional health should be also taken care of very much. So because in our when I was a child, so I only studied about the body part, like so we always heard this word human being, but never we never give attention to being part. Like so, as we can understand this word human being is human is the word coming from a Latin word humus, like it's soil, it's indicating body. So in medical science also we were learning only about body. Like in our childhood we were taught like circulatory system and respiratory system and nervous system, but we are never taught about these aspects like mental health and social health and emotional health and spiritual health. We were never taught, but the irony is that we are in the land of spiritual land, India. So we must address this to our children, that being part is missing. So it's very now UHV has come, and I'm teaching UHV to our children. So it's very UHV has given us such a nice platform to address that issues. So it's really nice to have now to address all these issues here.
Thank you, ma'am. Thank you for your valuable input. Now, with this connection, I would like to call Dr. Umang. Doctor, you have a background in molecular genetics. So I wanted to ask you this question. So what about this mind and body connection? So is this state of mind impacting the health of the body? So what is your opinion on that? Ma'am, you're not audible. You can unmute.
Thanks a lot for this question. Yeah, it's a great question, in my opinion. Yeah, you're right. The mind and body definitely have a connection between, I mean, there's a very good connection between both of them. So what at the time, what you are thinking, it definitely reflects on your behavior, on your body, how you feel. So definitely, so, but whenever you just think of a day, so whenever you are not feeling well, so let's say you have some fever or something, then your mind definitely goes in different directions. Yeah, like you will think of why I have fever, why I'm not getting, why it's not getting, I'm not getting better, because if it takes so many days. Yeah, so definitely the thoughts go in the negative direction, and if we pay attention to these thoughts, one negative thought attracts more negative thoughts. It's a chain reaction, in my opinion. So definitely we have to just stop these thoughts first of all, so that we can address the main issue, let's say here fever, and only then we can correct. Otherwise, if we don't address the main issue correctly and just go on reflecting the mind, the negative thoughts, it definitely will not help.
Thank you, ma'am. And I would also like to ask Dr. Sasikumar, you have been trained in mental health. So what is your opinion on this mind-body connection? And should we be addressing conditions like also like peaceful state of mind and satisfaction within oneself when we consider health of an individual as a whole?
Oh, yes. Obviously, the mind and body is connected. There is, you can't disconnect the mind and body. So people, when they, like the traditional medicine, the current state of medicine, when they treat the body, actually, we don't treat the mind at all. When we say mind, it's not about depression, anxiety, and all those things. The mind, what I mean is managing the stress, managing the thoughts, managing the emotions, and managing all the negative emotions. Like, say, for example, a lot of people have this habit of, which I would say is a common thing, simple things like comparison, jealousy, and all those things. These sort of things has a great impact on the body, and people don't realize it. And that leads to somatization and a lot of chronic pain and all those things from because I treat a lot of somatic illness, and that's all emerged from the mind. Yes, the mind has a definitive influence on the pain, on the body. Somatization is not just pain. It could be anything. Say, for example, the person can have a dizziness, and a person can have other sort of things like palpitations, anything for that matter. So instead of when a person goes to a cardiologist for palpitations, he gets treated for that unnecessarily, with so many investigations and so much unnecessary treatment, which has a greater impact not only on the individuals but also on the whole healthcare system. So that's why addressing the mind is a paramount importance. Thank you so much.
Thank you, sir. I can very well relate to you from my own experiences. All the symptoms you said, like pain and dizziness, I had all of these during my post-graduation period, and I didn't know why it was happening. And later on, I found out it was due to stress. Thank you so much for that scientific input also. So I think this very clearly has given us an idea about how mind is influencing the body through the thoughts and somatization. Thank you, sir. Thank you so much for that. And now I would like to ask Swapan ji. So when it comes to many chronic diseases and non-communicable diseases, are we largely managing the diseases, or do you think we are curing them at the root?
Very nice question. Although I'm not a trained doctor, but then uh, during our discussion since start of the day, and then even you put it up very nicely, and even other panelists are doing all this discussion. So definitely yes, we are not. Means all these diseases are just being managed. Even other panelists have said like. Uh, are we means trying to means we are just trying to decrease, like for example sugar, we are just trying to decrease the sugar, means are we going for what is the root cause of the sugar, like so uh, I think presently we are not looking at holistically. And then even somebody means even we are talking about the cancer, and then even Dr. Rao talked about insecticides and pesticides. So cancer is again being managed, means, and we are very happy that okay, we are finding many solutions to treat the cancer. But then why cancer is already there, means there. So what is the root cause? So I think we are just right now we are just managing the diseases, and especially these psychomatic diseases like hypertension and all. But we are not finding going to the root cause. Like already you have introduced me, like I've been exploring, so I can tell my experience. Like I used to have a constant headache for many years. So I just felt that okay, this is maybe the body ailment, and then even I had fears that okay, I may develop a tumor like that. Those fears came to used to come to my mind. But then when I got these proposals from UHV, and then I started working on myself, as Dr. Sasi said, that mind and body, and even Dr. Umang said. So then I started exploring self-exploration. That okay, even in our keynote address, Ganesh sir has told, and we are exploring the well-being of self. So even like Dr. Umang said, if our self is disturbed, so I found that ultimately that it was a self which had a lot of contradictions, a lot of beliefs, assumptions about my relationships. I was suffering from there, but then ultimately it was coming to the body also. So a lot of contradictions, which was taking toll on my body. But then I started getting resolved by knowing the reality. Like somebody was telling that, okay, how can we go about it? How can we have emotion control and all? So my feeling is that can we know the reality, like what is harmony and then relationship? And slowly my understanding, right understanding grew with harmony. And then obviously, I didn't come to know when my headache starts decreasing. Now it is all over. No, sometimes again your those habits die hard, means anxiety and all that. We are not being trained, as even Dr. Monica said, and all said. So at high time, I think the education, the holistic part has to come. And then even I was trying to find out the solution by doing a lot of walk, lot of stress, lot of body works. Sorry, this physical workout. It was just a piecemeal solution. But then when I started working on myself within, then I think it got resolved uh, forever. Means I think that is a solution. Otherwise, we are just managing the problem. Like I just managed for many years, but now for last few years, I found the solution. And journey is on. Thank you. This is from my side.
Thank you, Dr. Swapan. Now, I would also like to ask Dr. Vidya's view on this. So, do you think we are largely managing diseases by addressing only the symptoms, or are we looking at the root cause, like Dr. Swapan rightly pointed, of these non-communicable diseases? Do you think we understand root cause of most of these diseases and we are addressing them at the root? Please
Uh,
unmute. Yeah,
I'm audible now.
yeah.
Yes, Dr. Nalini, I cannot fully go with sir because it is not like say for example for cancer, sir is telling like we are not treating the root cause, but it is not so. Still, we are under progression finding out the root cause of the cancer. Certain diseases like diabetes and hypertension, the main thing is lifestyle modification. Even though we stress on this to the patient, it has to come from the patient side also. Not only it is not like a one way, like we are not treating the root cause and we are giving a symptomatic treatment. Why the doctors are doing like this is my perception is patient will be satisfied suddenly if they saw the blood sugar level decreased to the first compared to the first visit. If that happens, they are thinking like it is okay, we are in a right point and the doctor is giving the correct treatment. But even then, if we advise them, don't go with the medicine, first start with the lifestyle modification, and it is a better thing. Anything if we try to explain, other than making them agree with what we are saying, they are not satisfied. So they think like if we have to give some medicine and it has to react properly, immediately they have to see the result according to them. So what we are doing first, we are giving that treatment, we are giving a drug, they are taking the drug, they are reducing the blood sugar. So after whatever we say, they are not listening. If we are stressed upon the lifestyle modification, just a simple walking, they are not able to do. They will be coming with lot many reasons for not doing that, but they won't find even a single reason to maintain that lifestyle modification. That is my perception. uh, from both the sides, the society, individuals, and the doctors, everything has to be. But still, there are some corporate hospitals. I don't know, like I'm not pointing out anything particularly, but still there are some corporate things. They are making money out of these things. So that also has to be stopped. And individual also has to realize that rather than taking medications, they have to modify us. Some person, some doctor told like they should know what the food they are eating. That is also very very important at this point, because food is all full of pesticides. So we are now going back to our ancient times. We are taking millets now, but 5 years back when doctors advised to reduce rice and take millets, people were not agreeing with that. They were looking at like aliens. But now they are realizing that, and they are going back to our ancient times. This is not a new thing, this is what we are following long back. But as though the social media is creating as though they have discovered something and they are in a new era. It is not like that. Now only they have started realizing all these things and going back and getting the right thing. I think this is from my perception.
Thank you, Dr. Vidya. The time given to you, you have pretty much covered the entire aspect of holistic health, starting from root cause of management, people expecting immediate results, corporatism making money, and so on our food intake. So we have a lot more to discuss. So I would like to ask Dr. Eloji Rao. There were lots of discussion about this cancer. And you also, in your previous answers, you pointed out this interconnectedness of human being with nature. So, do you think human beings should be viewed in isolation, or do you feel that more awareness regarding nature and its impact on our health should be there in our educational curriculum?
We are part of the nature, and whatever we see outside our body, we also see it is inside our body. Who are we? Made of 5 Panchamahabhutas. What we eat food is Panchamahabhutas. What it is going to translate into is our tissues, again related to Panchamahabhutas. So if you look in isolation from the nature, we'll be missing ourselves in terms of how to take care of ourselves in the beginning to begin with. That is number one. The second one is, if we were taking it in isolation, how are you getting treated yourself? You need the nature in front of you. All the things that you want to use for your own protection, treatment, and everything is from nature. However, if I want to use the Charaka Samhitas, that if we are what we eat, in isolation of nature, what are we going to eat? Isn't it? So I think the best situation that we need to understand is who are we from the viewpoint of nature, how we are growing in terms of the nature and we together. And I think that is the reason why there's a very nice statement, right? Who are we? We are what we eat. And there are two things. One is anna, another is ahara. I did not know the difference between
Sir,
it in last couple.
sir,
Yes.
Eloji sir, just a small request. We are all very new to these terms. If you can just explain it in some single terms in English, it will be useful for everybody of us listening because these are
Yes,
all some very
I'll do
interesting
that.
points you are giving us.
I was going to tell the difference between anna and ahara. Anna is the food that we consume through our mouth. Ahara is the perception that we have, experiences we have through other four senses. Anna is through the taste, mouth. So the aspect of anna is going to transfer into who we are in terms of how we grow, how we behave, and all those things, right? So in terms of the nature and the synergy with it, if we understand what we have to eat and how much we have to eat, when to eat, I think we'll be in pretty good shape. Unfortunately, there is no understanding in terms of what we eat, and therefore it is manifesting into multiple things. If you take the same family, one sibling is suffering with cancer, another sibling is suffering from diabetes, another sibling is suffering from obesity and things like that. Why? Because the nature of food they consume, the amount of food they consume are different in terms of the synthetic chemicals that is coming into our body and its manifestation. That's all. Because the timer was there, I just stopped there.
We'll definitely come back to you, sir. We are getting so much inputs from you. So regarding this interconnected with nature, I would like to ask one more question. Like, should we consider the quality of life in addition to the longevity of life when it comes to indicator of good health? I would like to ask Dr. Umang. So what do you think is a good indicator of health? Is it quality of life or the longevity of life?
In my opinion, it's a clear quality of life. Yeah, let's say, what will it bring if I lay down? I'm on my bed for let's say 10, 15 years. What is the what will it bring to me or the caretakers? It's definitely a burden on the caretaker, a burden on the society, a burden on the insurance systems, on I think the whole nation. So in my opinion, definitely the quality of life is overweighs the quantity of life. So definitely we have to take into consideration the quality of life, which really definitely inculcates not only how the person is being treated physically, mentally, socially. It's a holistic approach should be taken, definitely, which is why we are here today. So definitely for the quality of life, if we can spend our the whole the our let's say our money on the quality, not on the quality. If we just focus on the quantity, it will definitely bring no additional no additional years to the person if he's just lying on the bed and just counting his days. So definitely the quality matters a lot, and for that you have to address all the things into consideration so that he or she can live happily till the last moment. So
Thank you, Dr. Umang. I would like to have more insights on this topic, the indicator of good health. Is it quality or the longevity? So I would again ask this question to Dr. Monica. What do you think, ma'am?
Yeah, so I have heard panelists. I want to say, like, here we are talking about just Rao sir said, how should we take food and how should we do our activities, you know? So it's I think if we only think about managing our body, so then somewhere we will miss the I want to give a simple example. If we know the running of a car, then somewhere we can struck on road. If we know, if we don't know about its working principle. So it's just similar as for our body. Just if we know how to manage our body, how to run our body, but we are not knowing how to what is the working principle behind that. Yeah, like in universal human values, as we are learning that we are composed of human being. Like I said, we are composed of self and body. Like this word itself suggests it's health. Health itself contain its meaning like heal. Thigh is yourself, heal yourself. So somewhere self is central to this physical body. So if self we know this principle of working principle of self, how it is in how should we instruct our body to certain incident or event, then we can only cure body well. So we are managing body, we should know the working principle of self, so we can somewhere reach the point where we are all here to discuss this. So it's so disease itself is not about its word itself contain the meaning like dis-ease. We are not at ease, and it's I think it's not telling about the physical body is not at ease. It's about mental and emotional. We are not at ease, and that's why we can see that when simple example I want to give from my life, when I suffered from acidity. Then if I give some time to me for relax, then I feel that this acidity has gone. So somewhere something is missing here. So we should address, we should heal ourselves. That's I think. Thank you.
Thank you, ma'am. Thank you. You rightly indicated many diseases which will be affecting the quality of life and how important it is to take good care of quality of our life by understanding the working principles of our body. Very nice to hear. So now, Dr. Vidya has pointed some of other concerns also, like lack of values and monetization. I would like to touch on those points also. So there's this general concern regarding lack of values and lack of compassion in our healthcare system today. So, what do you feel about that? So for this, I ask Dr. Sasikumar.
Yes, thank you. First, I just want to address the previous question. I think Dr. Uma has raised a very valid point. The important thing is there's a slight disagreement on that point with myself. Yes, yes, quality is very important, but at the same time, we need to address the quantity issue as well. That what I mean by quantity is the longevity of the person. The modern medicine has done enough now where the person's quantity of life, the longevity has been extended so many years at the expense of the quality. I can see it directly because my average patient's age is 70 years. And I see patients from the age of 70 to 100. That's my demographic where I work with. So the issues here is these patients are living longer. Yes, the medicine has done it, the modern medicine has done that portion. But the quality, what we are seeing is absolutely missing. And these people really suffer. And why they suffer is because the other aspects of the things, what we talk about the holistic medicine is missing there. So I think once we incorporate that holistic medicine into that, so we can have both quantity as well as quality there. And most of my patients, they come to me with initial lack of quality, but I see many of my patients, they have a better quality of life till 100 years now. So this is my own personal experience. So by incorporating those features there, you absolutely increase the quality of life. Thank you. And your next question, sorry, can you ask me about the next question? It's about the values?
Yeah. There's a general concern regarding lack of values and lack of compassion among healthcare professionals towards the sick people. So do you think it's a genuine concern?
I think from the patient perspective, many people would say that I think in India that concern is rising. The main reason is because of the population overload, and everyone is when they are stuck with time and resources. I don't think even with the best interest of compassion and everything, you can really satisfy that needs. And for that, the other issues, other healthcare system has to be addressed in total. But I don't think that healthcare professions as per se lack that compassion, but I heard from Dr. Vidya that they are incorporating those value system, but I think those value system has to come from inside as well. Now people are lacking that, and they're getting those inputs from social media is really, I don't know. But most of the doctors whom I see, they have a lot of compassion, but sometimes it is difficult to do it practically. That's a different thing, but that's where the system has to be addressed in total. Yeah, thank you.
Thank you, Dr. Sasikumar. So regarding this lack of values, Dr. Swapan, do you think this concern is genuine? And do you have, what do you think is the reason for this? Or what is your idea about this?
It's very nice input given by all the panelists, and even Dr. Sasi addressed it. So very nicely, Sasi ji said that the values have to come from within. So I think we are all not looking within, and the concern, the focus right now is outside. So all this, even the doctors and all that, even sometimes means are they being fulfilled by doing all this, means managing the disease, although they are doing a great job. Like even Dr. Vidya said that lifestyle, even the patients are not following it sometimes. So doctors are trying to tell them, but then this all ethics and all this profit maximization is coming to all the professions. So I think even the medicine, it's there in the medicine also. So in that way, it's very important to know that, okay, in the medicine also, I think the competition and all, to start with, even the examination from where the students get into the medicine, it's very competitive, and you see around, the youngsters are doing only the technical subjects, and I think and even when they go to the hospitals and all that, when they join that, it's again a very competition that, and then even doctor is known by number of patients and all that. So I think they are also in that loop sometimes, although they want to show the compassion, as Dr. Sasi said, but then sometimes we are not aware. That is, I think, the high time, this holistic value of education we have been talking about since the start of the day, that holistically we have to see means what we are and what we want to be. So I think it applies to the medical doctors also, that harmony is so important for them also. So yes, they're treating, gratitude for them that they're treating so many patients with a lot of serious diseases, but then all these statistics which you have told, that they're alarming, and the doctors also, I think they also have to all this ethics and values. I think it's a universal value education system. It has to come to all the human beings have to go through that, so that they also show empathy and they give more time to their patients and all that. So yes, I think we have to start looking within and trying to find the solution centric rather than this problem centric we are going. So that's it from my side. Thank you.
Thank you, Dr. Swapal. So we'll just move on to this sustainability. So there's another concern that was raised, that healthcare system not being accessible to many and not being sustainable in its current form. So do you think this is a real concern and something that needs to be worked on? Dr. Umang, what is your opinion about this?
Yes, of course, I agree with the point that the current healthcare system is not sustainable. Let's say, because if a person has got a chronic disease, he will first of all go to the doctor. First of all, he will pay so much amount of money just for the diagnosis, which it's not, the treatment is not yet included. It's just a diagnosis, and after the diagnosis, he has to start the treatment, which takes so many years. Let's say for chronic diseases, let's say till the last breath, he or she has to pay. So definitely in this, and at this moment of time, I can say it's not sustainable, and it has to be we have to work on it to make it accessible to everyone. So what I have heard in India, this Ayushman Bharat care system, so which is the initiative from Prime Minister Modi, is really a very good step in this direction. So I mean, the poor can also have the access for, let's say, a definite amount of money to get themselves treated. So I mean, definitely it's we have started in this direction, but definitely it's a way more to go forward. And definitely not, we have to, for this we have to, like, for this, in this direction, we have to take into consideration each and every step. We have to take into consideration not only the disease, but the doctor who is treating the disease, the diagnostics instruments or diagnosis, how much is it costing, the caregivers, the healthcare professionals. You have to take everything into consideration so as to make it accessible. And the very first important point is, before this all this comes into play, is the awareness, which I think is not, the people are not fully aware of their health. So we have to make them aware of the consequences. So if the about having the not having the good good lifestyle, or not living in harmony with the nature. So I mean, each and every thing has to be taken into account before we take a step forward to make the healthcare system accessible, sustainable in this direction. Thank you.
Thank you, Dr. Umang. Now, Dr. Vidya, what is your idea and your views about this healthcare system in its current form not being sustainable and not being accessible to many?
So, according to me, I cannot accept it is not sustainable and not accessible, but there is a lag. I can accept there is a lag. For me, there are two perceptions. One is awareness and one is money. So, basic thing is there are certain disease which can be treated at the basic level itself. That is, a normal general practitioner itself can treat the disease. There are certain disease which has to be treated especially by the specialist. Say, for example, surgical gastroenterologist or neurologist, like that. So here, due to the illiteracy rate, certain people, they don't know whom to approach, where to approach correctly. So instead of approaching the right doctor, they'll be taken in a different directions. They'll be going through lot many struggles before they are reaching the particular person itself. That is because they don't have that proper knowledge. Another thing, extreme opposite to this is they'll be having a simple headache, but they'll be affordable. They'll have lot of money, so they straight away they'll go to the neurologist and they waste their neurologist time actually. So instead of treating a patient who is really disabled, they'll be treating these patients for just for the sake of money. To spend money, they are coming and sitting here. So there are many things to be think of, to be ruled of. So if these are the reasons why there is a gap, according to my perceptions. So the doctors, they are pulling out the doctors' time unnecessarily. So what I think is the right way is, first, if you have any diseases, government has given many things. There are something called as primary health center, secondary health center, and tertiary health center. So whatever it may be, first some diseases are there, means they have to go reach the primary health center. If it is okay to be treated there, it has been done there itself. If really something is intervention is needed, that particular doctor has to make it register, make it a point, like immediately they have to shift it to the particular specialist and the treatment has to be given. So there is a lag in this. So because of this lag, apparently it seems like this healthcare system is not sustainable and not affordable. And one more thing, this rural people still they are struggling, I accept. And another thing, government has given many schemes now. As ma'am told, Modi ji has given a special scheme. In Tamil Nadu, in our state also, we are having a special health scheme. In this scheme, many patients are getting really benefited because they are giving full exception for the surgery. Only for the medicines they are taking money. Other things fully accepted. Another side, if you go to the corporate side, so obviously they are making some money out of the normal things because people who are going there are ready to spend also, because nowadays this IT professions, they are the company itself is spending the money, so they wanted to use that. So for that they are unnecessarily stealing the time of the practitioners. So this time has to be given to the needy people. That is my thing. So that gap will be patched up. So it will be sustainable and it will be common to all. That's my perception.
Yeah, thank you, Dr. Vidya. So I think we have pretty much covered most of the concerns which were discussed today, like the current state of our healthcare system, our health education, about stress and mental health, and focus more on the disease, like lack of values and human beings treated in isolation and the sustainability. Now, I would ask the final question of this panel discussion to all the panelists, and I would like to hear your views on that. So, should we be trying to address these various concerns regarding health separately, or could a more holistic approach to health perhaps address many of our concerns? So, should we be looking at health in a more holistic manner? So, do you think there is a need for a holistic approach? I'll start with Dr. Sasikumar.
Oh, yes, definitely, Dr. Myrna. The important thing is, as we earlier spoke about the sustainability and the affordability and all those things, the biggest question the world is facing now is whether the healthcare system will be sustainable in the future, because the chronic conditions are getting out of proportion. So that's where the economists and everyone are working on it. But the answer is, if it goes in this proportion, it is going to be unsustainable, and this everybody knows. And the only way to get that into control is, I think, to address it in a holistic manner. So when you address it in a holistic manner, what happens is then many of the chronic conditions gets under control. When things get under control, it's only less of the symptoms, less of the management you have to do, and that thing management you can do it. Yes, then it becomes sustainable. The other thing, what I drew from Dr. Vidya is she made that's an important problem in India, where the healthcare system is abused both by poor people and also by the rich people as well. And one thing is the lack of that's where we can draw from other countries. Like in Australia, what we have a proper general practitioner system where 80 to 90% gets filtered out, and only 10% to 20% goes to the go to see a specialist. So that's, and the healthcare practice and the general practitioner, they have a large interest in doing things holistically. And when you go to a specialist, they just address the symptoms. So this is where the general practitioners play a pivotal role. And when you do it holistically, yes, many of the concerns can be addressed at the individual level, their productivity increases, and then at the community level, the healthcare system improves, and thereby the whole functioning of the system improves. I think that's the answer, the holistic healthcare. Okay.
Now, Dr. Umang, what is your views on this? The need for a holistic approach to health?
I would say definitely there's a need for the holistic approach, and in this holistic approach, I'll definitely touch upon a lot of topics before addressing the root cause. So I would say during the holistic approach, I would first of all make the persons or the community aware of the different diseases, and not only this awareness about the diseases, but about the self developments, hygiene control, and the lifestyle, so that we take into consideration all the things before we make a conclusion about the person's disease. So all in all, we have to consider these points and as to move forward. And a holistic approach in this direction is definitely will be helpful and will be a first step towards the sustainability, and will save a lot of money in this direction, because as we told that our healthcare system is really getting burdened.
Yeah, thank you, Dr. Umang. Dr. Swapan, what is your opinion regarding this need for addressing this health in a more holistic way?
Yes, I think we all are reaching to this conclusion that holistic approach is needed to today to address all these medical issues. Because if we are just making it a body centric, and then we are trying to make this early detection of disease and then trying to manage the disease. But then there is a solution centric also approach can be that can there be health in the body naturally, like even I agree that doctor even say the first thing they say that okay, change your lifestyle means all this. Not only nutrition intake is one of the parts like Dr. Rao has said, but then your daily routine, and then even the physical work, or if not physical work, at least exercise. But today you see the youngsters and all that lifestyles have become so sedentary, and there is no physical work, no physical exercise. And then this concept of well-being of self or mind. And then obviously, again, this environment is very important, I think, of all this discussion. Means family, society, and nature. You see that nature is also causing a lot of diseases which we can prevent, like the pollution and all. I think the doctors know better that how it affects this all chest infections, triggers asthmatic condition. So all they can be prevented if we talk about this holistic education. Even we take nature into consideration, family relationships that I told you that okay, that if we work on that. So I think this all has to be brought in every education, but especially like in BTech, because I'm teaching into BTech and all that. In technical courses, BTech, it has already come. But I think in the medical education, it's still coming or not. It's again a discussion. But then holistic approach is needed. There's no doubt about that to solve this sustainability. Even this means so much crowd is coming with the preventable diseases. If they will not come, even the doctors will have more time to give to the patients. They're also under pressure with all this unwanted patients. Sometimes they're coming. So prevention is better than cure. This is what we have been hearing. But now we have to bring it in practice. Thank you. This is my observation. Thank you all.
Thank you, Dr. Swapan. That was a very nice point you said. Like, if there's a more holistic approach, preventable diseases or diseases burden is reducing, and doctors can spend more time on the really needy people. So I would now like to ask Dr. Monica.
Yeah, so it's really high time to taken care of holistic approach. So it's just like Swapan sir said that prevention is better than cure, and I agree upon that. We can prevent some diseases. So there is, as we can see, there are so many multi-specialty hospital, and government is also giving so much facilities for hospitals, but still diseases are so many, new diseases are coming day by day, like Alzheimer and Parkinson, and some mental diseases are nowadays are very common among our children. So as if we see economically, so we all have some limitations for the patients also, and for government, for there is some limitations. This is as a physical factor, so monetary factor. So we can, if we prevent this disease from home only, then we can somewhere we can resolve this issue of sustainability, and we can also resolve this issue of some common diseases, like which we can treat ourselves, like depression. If we know the family well, and we can, if we address values, our values, like it's very irony that it's our property. Values are our property, but we are learning this somewhere in our earlier times. We are living in such a big family, and we are in relationship. So somewhere, if we are in some emotional pain, if we then we can address to our sister or our relative. But nowadays it is missing, so it's also matters a lot for disease. So somewhere we have to see our family values, our we have to maintain this family values culture again. Then we can reach that state which we want to resolve sustainabilities and a holistic health approach. Thank you.
Thank you. Thank you, Dr. Monica. So you have now set the stage for tomorrow's topic, like our connections of human being with family, society. And yes, we'll be saying more about that tomorrow in the vision part. Now I'll go back to Dr. Vidya. So do you think there's a need for a holistic perspective on health?
For me, I have a different perception. Like already we have started this holistic approach. As I told you, no, that it's NMC and all the medical educations, even the National Institute like us. We have started the holistic approach. The foundation course, we are starting from the ADCOM, means attitude and communications, the way the doctor has to behave with the patients, and the one professionalism we are teaching, ethics we are teaching. We are having yoga classes separately for physical activity, meditations, and these are mainly to reduce their stress level. And this nowadays, the younger generation, they need more. So we are slowly we are introducing everything. Only thing what I felt is like there is a gap between what is given in the paper and what has been practiced actually. So if the what we have framed as a part of the foundation course, if it has been uh, come exactly on the show, then this holistic approach we can completely evolve. It will be nice for us. For the doctors also, it gives some relief, and for the approach to the patients also, it is there. Ethics is we have to follow all our ethics. Definitely, this holistic approach is going to get benefited. And one more thing, everything has to start from the individual level, as sir pointed out rightly. So, individual family values and the society, and then it comes to a frame. So, I also agree with this holistic approach is going to help in medical education, definitely. So, that's my thing.
Thank you, Dr. Vidya. Again, regarding the starting point in the individual level, we'll be seeing more upon this human being and individual, how to address this at the individual level tomorrow. Now, Dr. Eloji, your views.
It is very interesting when you say holistic. I think we ourselves have to look into a little bit more deeply. Earlier, I said we are what we eat. Obviously, the lifestyle, physical exercises, and the mental, emotional well being, all those things are very, very important. But am I the same person today versus 5 years ago, 10 years ago, but 20 years ago? I think the changes are happening within ourselves. I think that also we need to be cognizant about it. So I would like to take just a few slides to illustrate the importance. Let me see here. See, in 2021, when United Nations declared International Year of Fruits and Vegetables, I, as a researcher, looked into the current status of India, and I found that India was not ready to celebrate International Year of Fruits and Vegetables. Why? There are plenty of contradictions and challenges. What are they? Probably we all know that the amount of food what we are producing in India today is almost 3-4 times in terms of calories that what we consume. 3-4 times. And look at here. What are the other challenges? We are using lots of chemicals, and transfer of the food items from field to plate and transfer of the chemicals from manufacturing plant to the field is adding a lot of carbon net neutrality. How much preservatives you are using today? Uncontrollable level. Recently, I saw an article, 30 grams of red dye is allowed, but that is there in 3 different items, and people will use it definitely. And we are way, way beyond. So we are using lots of preservatives. Our scientific findings are talking a lot about the linkage between gut microbiome and the brain. They consider it as a second brain. Do we cognizant about these facts? Absolutely no. And look at this. This makes me like, so angry. The health system in the whole world, the inefficiency of the people with respect to health requires intervention in terms of the C-section only to about 3, 4, 5, 6%. The global average is 1 in 3. What is in India? If you go to the metropolitan cities, there is no choice. Doctors and the system will put you. And all these contradictions are impacting significantly starting from the birth. The same brain has to grow, and that is proper nutrition. That is why I said when you say holistic, outside is one aspect of it, inside is another aspect of it. If the expecting mother doesn't get the nutrition, the brain is not going to grow fully. That needs to be supported for almost 21, 22 years for the fullest growth. Now imagine if the nutrition is not there, how in the world the child's brain is going to grow? This needs to be supported for 21 years, means mother, father, family, system, as well as the support. And that is why the awareness is what is required today, where we are what we eat, and that is why we have focused into multiple awareness campaign that includes all ages, all stages, and all phases. I think with that, I would suggest that when you talk about holistic system, we need to also consider the changes in us, and we are also a moving target, and therefore the holistic system will also become a moving target. This needs to be recognized and addressed appropriately.
Thank you, Dr. Eloji. We are getting more and more of insights from you. Thank you so much for all your inputs. And I thank all the panelists for all your valuable opinions in today's discussion. That was really very interactive, and really, even I learned many new points from you all. Thank you so much for that. Now, there is the last 10 minutes. We'll open this forum for question answer session with any delegates who are watching this, or even YouTube viewers. You can post your questions, and you can specifically mention to whom would you like to address these questions if you have any.
While the questions are going to be coming, I really thank the organizers and an opportunity that is given. Thank you.
Thank you, Dr. Railoji Rao. I would really like to thank again all of you for spending your time and putting more efforts and giving more and more points towards this panel discussion on the topic. So by the time we wait, let me tell about tomorrow's panel discussion. So today we have discussed about the various gaps in our healthcare system and the concerns which we are facing today. And we had some mixed viewpoints from all of you. But at the end, we were all able to come to a consensus that this holistic approach is needed to take this healthcare system in the long run. So, and some very specific points, like from Dr. Vidya, she said it has to start from the individual and understanding at the individual level. And Dr. Eloji Rao, you said outside is one aspect and inside is another aspect. Again, speaking about importance of how human being is there. And we have Dr. Umang with us. She is a nutritional toxicologist and a molecular biologist. She has published many papers in that. So tomorrow in our vision for this holistic health, we have many topics that are related to all these things. So I'm eagerly waiting to be hearing from all of you. And we have Dr. Sasikumar, who is already practicing this holistic approach. So I think you will all have more to put in your insights about the vision, how this holistic health can be taken forward in the long run. And I think that is going to be more interactive and useful for every one of us listening here. So if panelists, you are having any questions which you would like to ask, address other panelists, You're open and you're free to ask. We have 8 more minutes.
I'm open to take questions.
I would just like to thank all the panelists. So it was a very healthy discussion from my point of view. So I enjoyed a lot, and the takeaway message I would have from this discussion, yeah, definitely I would say that summarize in one word. So the inner engineering is really important before we focus outside.
I'd like to add one point for all of us, and that is, I think in 2016 or 2018, ACP, American College of Physicians, after doing research in multiple countries, they revisited what is diabetes. And what they said is that the below 6 or below 7 is not the right indicator, because we are over treating diabetes with lots of medications. So instead of the benefit, the medications are going to be causing lots of side effects. So they urged it to change from 6 to 7 or below 6 to 7 to 8 for type 2 adult diabetes range. And although it is there, the general medical profession has not accepted, not adapted in their life. So I will urge you to take into this particular aspect of no, 6 is not diabetes, not 5.5 is pre-diabetic, something like that. It has to be, you have to give some space. I myself, when I came to America in 1995, the diabetes was morning, what is that, fasting sugar was somewhere between 120 to 140. They reduced it to 100 to 120. Now it says below 100. The reason is the drive from the pharmaceutical industry is pushing to such an extent that although we are not, from their point of view, because they consider we are so, although we are not, we are end up pushed into consuming these drugs to larger extent. Something that we need to be professionally, ethically to be cognizant about and see how we can fight this. We have to fight at this point of time. But it is the medical doctors, medical profession has to think about it and see what they can do.
I just want to thank everyone for all your valuable contributions. And Dr. Rao also said a valuable point here, and maybe we need a further discussion on that as well. And yes, it's not only the blood pressure, it's not only the sugars cutoff point has been reduced, but also the blood pressures and other parameters as well. So there is a lot of issues on that things. That's a bigger issue need to be looked into. Thank you.
So,
Yeah. Didi, may I ask a question?
yeah, sure. Didi, please introduce yourself.
Yeah, this is Aprajita Singh.
Yeah.
I am exploring the UHV content since some time now. I'm assistant professor with the MCA college at Mumbai. So, Didi, I was just just listening to everyone's the panel. It was very enriching. I was just having that. I was just thinking that once when I'm aware of what is going on, then I'm able to make out that okay, this particular food that I'm eating, is not going well with me. When I am eating this, always there is some headache or a stomach ache. So like I think that even that self-awareness also so many times happen to reduce so many ailments that we are having. That is what I was thinking.
So, would you like to ask any specific question to any particular panelist?
Gee, I would want like if Yeloji Rao sir can just help me with that.
Yes. So thank you, Aparajita ji. Thakur Institute of Management, Mumbai. Wonderful. See, let me give you one simple example about the difference in modern medicine in terms of the food we digest versus the traditional methods understanding in Ayurveda texts. I'm not an Ayurveda doctor, but this is what I learned. The digestion, modern science, just say you eat the food and you get digested. It's not so easy. It is not so simple. It is not that straightforward. I mentioned we are eating 5 Panchamahabhutas, solids, liquids, temperature, air, ether, everything, right? So every food needs to be digested differently. In other words, processed differently first. So mixing with the saliva and the enzymic juices in our stomach is one. Then converting each of the Panchamahabhuta into ingredients is the 5 reactions, 5 Panchamahabhutas, one major mixing, 6 steps. Then comes the tissue formation. 7 major tissues are included in our body. That conversion takes place multiple days in certain cases. So those food items, when it is going to form different tissues, that is influenced by the taste elements which acts as a catalyst. Now, if we understand that, what it is, why it is, then we would be able to have probably a better life, healthy life. Now, let us look in the screen itself, okay? So many people, about 14 of us, we are all having different shapes. Somebody is tall, somebody is stunted, somebody is wasted, somebody is obese. If you go beyond 14 also, you will see so many differences. Why? Simply because the way the tissue is produced in our body based upon our Sharira Prakriti Vata Pitta Kapha. And therefore, understanding this holistic in terms of we are what we eat means what we eat and how it helps us to become who we are is something that we need to recognize, which is a bigger piece missing in the modern medicine, evidence-based medicine. That is one aspect of it. Second, I will tell you, for different diseases, we end up taking tablets or medication, some medication. Because our stomach environment is different, which manifests into Vata, Pitta, Kapha, different personalities, the injected medicine, consumed medicine has to first disintegrate into make and release the drug molecules, isn't it? First step. Then only the drug molecules will be helpful. However, if the drug molecules are released, but our stomach environment makes them into some kind of binding complex, then drug molecule is not available. Now we take any of the allopathy treatments, any of the medications that we use, in the clinical studies, what is the efficacy? If the drug molecule is really working, it should work for everyone, isn't it? It doesn't. It may be 55%, maybe 58%, maybe 56%. Today, the modern medicine is not looking into the personality of the individuals, prakriti of the individual, so they cannot correlate. They just put it everybody in one bucket and see how many people got treated or not. So the medication are not general medicine for us. And that is why I think the learning is slowly but for surely leading into something like a customized medicine. I think it is a long answer, Aparajita ji, but if you let me talk on this one, I can talk for another 1 hour, but I'll stop it here.
So tomorrow also we'll be discussing more on these same topics. So we'll get definitely you will be having more time and we'll be getting more inputs from you. So it's almost time up. I think we can stop here. And I once again wholeheartedly thank every one of you who are present here and for making this a very beautiful discussion and a very meaningful discussion. So thank you, everyone. We'll all meet again tomorrow. And I think the times are shared. So thank you so much. And thanks in advance for joining tomorrow also. So have a nice day.
Thank you all. Looking
Thank
forward.
Thank
Thank
you.
you.
Thank you all
Thank
esteemed
you all.
panelists for a very fruitful session, and Dr. Mrinalini, who was the moderator for the session. Thanks to all the delegates who have joined and also all the participants who have joined via YouTube live streaming. The schedule for the conference is provided in the website. So the next session, this shift will start as Mrinalini pointed at 7 p.m. tomorrow with the keynote lecture on education for harmony in relationship from family to world family. And we have the panel discussion also along with that. So you can view the details of all sessions from the session tab in the Zoom window. More details can be seen in the website uhp.org.in. So thank you so much for joining. Namaste to all.
Namaste and
Namaste.
have a good day. Shubharatri. One or the other.
Thank you. Thank you so much.
Thank you and namaste to all.
Thank you, ma'am.
You and namaste to all.
Thank
Namaste.
you.
Thank you, doctor. Bye.
Bye.
Yeah.